Hello everyone, I am Richard Gwenda from Sierra Leone, a member of this year's 10 cohort, Policy Advocacy on Genetics and Genomics, course 2025. With me is my colleague Hassan Jawara, representing the affirmative side on the topic, should mandatory genetic-based vaccination policies be implemented in public health? Introduction to our findings. Genetic-based vaccines like mRNA or DNA vaccines, they use genetic instructions to train the immune system to recognize pathogens. These vaccines play a key role during COVID-19. As example, the central question: should government make these vaccines mandatory for the greater good? I will say yes. Imagine infectious disease threatening global health. Mandatory genetic-based vaccination can drastically reduce transmission and death rate. How is this possible? When a country is vaccinated, the people in that population have much less likely to spread the infection from person to person, which is an importance of mandatory vaccination. Also, it helps protect them against many infections. When these vaccines are skipped, the risk of disease is also increased. In this constructive argument, one may ask, what's the scientific rationale behind this topic? Genetic-based vaccines are faster to develop and adapt to new pathogens. Vaccines that are made using genetic material like mRNA or DNA vaccines can be created more quickly and adjusted more easily to fight new diseases. They are also known as robust targeted immune response. They respond to targeted immune to ensure they boost the immune system to fight against diseases as quickly as possible. Proven effective in large-scale trials and real-world use. Example is the COVID-19 pandemic. We all saw how the COVID-19 pandemic came and it was so crucial. But with the aid of the invention of the COVID-19 vaccine, it helped the immune system to fight against the immune response, which was the COVID, and it successfully came out, and all of us saw how the vaccine worked well. So that's a test case and an excellent result to show that genetic vaccines can be trusted and have been proven worthy to work with. Looking at public health benefits, herd immunity cannot be achieved without high vaccine coverage, but mandatory policies help protect those who cannot be vaccinated. Example of those people are immunocompressed, those who have altered their immune system, who have been faced with diseases that has damaged the immune system. Example is HIV. These are immunosuppressed patients, and mandatory policies help protect those kinds of individuals. We also look at the help it renders. It reduces burden, healthcare costs, and long-term implications. When the population has been vaccinated, the spread of disease is limited and the threat of death is also limited, because when the disease is not spread, death is limited. Looking at ethical policy and justification, you will understand that governments already enforce mandatory vaccines. Examples of these mandatory vaccines are measles and polio to protect the society. In certain areas and in certain countries, when a baby is born, the baby is mandated to take a measles and polio vaccine to help protect the child as he or she grows. Ethical principle of utilitarianism: the greatest good for the greatest number of individuals can be for the greatest number of individuals' rights can be limited to prevent harm to others. This simply means if the good is greater than the harm it causes, then it is essential that this is put to use for the betterment of the majority. This ethical justification also proves that it is essential to use mandatory vaccines. One may tend to say mandatory genetic-based vaccination policies, when implemented, the mandate violates personal freedom. In response to this, I say freedom must be balanced with responsibility, especially in a public health crisis. This simply means everybody has a right to freedom, but when it's a public health emergency, one should be responsible to ensure the greater good is done, and through mandatory genetic-based vaccination policies, we can achieve this greater good. Also, one may say genetic vaccines are experimental. In response, mRNA technology has been researched for decades and has passed rigorous safety evaluations and has been proven to be one of the greatest achievements in science. By this, we can use the COVID-19 vaccine as an example, and many other vaccines. In my closing statement, I said genetic-based vaccines represent one of the most advanced tools in modern public health, which has created so many values to the science world. When used responsibly, they can save millions of lives and stop the spread of dangerous diseases. Mandating such vaccines is not about control, it's about protection, prevention, and preparedness. We affirm that mandatory genetic-based vaccination policies are justified, ethical, and necessary for health and safety of all. Let's stand for science, protect the vulnerable, and build a healthier future. Together, through mandatory genetic-based vaccination, we can achieve a better future in science. Thank you.